Of course, this isn't just about the kids, but also about the school faculty and families at home. I have a few experts joining me today from their offices and homes, hence why we're not wearing masks. They're going to shed some light on the decision to help answer your questions about going back to school. Joining me today are Dr. Peter Bartz, cardiologist and associate medical director for the Herma Heart Institute at Children's Wisconsin, Dr. Kristen Binsick, pediatrician at Bayshore Pediatrics, Dr. Smriti Kari, president of primary care at Children's Wisconsin, Dr. Dave Margolis, program director of the bone marrow transplant and cellular therapy programs and the interim pediatrician in chief at Children's and the Medical College of Wisconsin, and Dr. Paul Veldhaus, pediatrician at Forest View Pediatrics. We've already had a lot of parents post questions. Please leave yours in the comments throughout this discussion. We plan to cover as many topics as we can in just the next hour: screening, testing, masking, and tips for helping kids adjust. We also want to make sure we address those questions with a variety of groups in mind: kids and families in general, kids with complex and chronic health conditions, school nurses, teachers, and the community as a whole. Before we jump in, I want to note that this conversation will be based on the information available to us today, which is July 28th. And we're aware that as more information becomes available, these discussions may shift or adjust. All right, let's jump in. Thanks to each of you for taking the time to answer questions today. This topic is something that impacts you all as you're in your work, but also most of you personally. Some of you are parents and have had to work through the decisions yourselves about returning to school. Can you speak to what you've experienced?
Sure. So I'll go first. So at Children's Wisconsin, we take care of kids 100% of the time, and that sort of dedication and commitment to taking care of kids has meant that people are looking to us for advice, and so there's a lot of questions out there. And I think as healthcare professionals, we're sort of used to using data and research and historical experience and trying to make recommendations. The coronavirus is a COVID-19 is a new virus, and so we've all been learning as we're going. And that's no doubt created a lot of confusion because there's a lot of new information out there. We've put together a team to really look at what the American Academy of Pediatrics, Center for Disease Control, the Department for Health and Human Services, everybody's working really rapidly to try and put these recommendations together. And we completely understand that families are anxious and looking to do the best that they can. And we're hoping that by sharing some of these recommendations today, we can help alleviate some of those anxieties.
Yeah, and as a pediatrician, we every day help families kind of navigate decisions regarding their kids, and school is always a huge part of that. This has been quite the challenge for us. As Dr. Kari mentioned, there's never been such a dichotomy between safety and educating our children. And I think, especially as a parent of 4 kids, as a school board member and a pediatrician, life has never been quite so complicated. And we're really trying to help parents just make the best decision they can based upon the data that we are able to give them at this time.
Yeah, and I would agree with that. Like Dr. Bensick said, a lot of us have formal and informal roles on school boards and with our local school advisory committees. So we're actively engaged in the conversation that way. I have 5 kids. I have 1 going to a public high school and 4 going to a local small Christian school where I happen to be the school board president. So I am kind of waiting on pins and needles for what's going to happen at my son's high school and kind of actively deciding what's going to happen to my other 4 myself along with my school board. And the decisions aren't easy. Every school building is different. Every school has different sizes of classes. They're in different locations. So what your prevalence is matters. So you're going to get a wide variety of opinions tonight from lots of different schools, and it doesn't mean that they're necessarily wrong, as each school kind of comes to the decision that's right for that specific school.
Yeah, and I would totally agree with everything that's already been said, and then also say it's a bit different for our patients and our doctors who are managing complex and chronic health conditions. Our families are often have to adjust their routines and decisions due to their chronic health conditions. And so they want to know as much as they can about COVID-19 and how this factors in. I've joked in my last 2 months of having clinic, on Wednesdays and Thursdays, really, I have this conversation with every single family in regards to how does COVID affect you and how does it affect your family and how does it affect your school? Again, I've joked that I should have this on YouTube, and I guess now I will have it on YouTube or at least Facebook, and I can just show it now. But it really affects everyone, and it's important to the doctors and patients and everyone as we go back to school.
Dave, you're muted.
Right. I knew that was going to happen. I'm almost never muted, and there you go. We got the first one done. Thank you. I'm the old guy here, and I don't have any kids that are in school right now. And being old, I've gotten used to saying I don't know a fair amount. And I think one of the things that we really don't, we're all working with limited data and information. If you think about it, this virus, COVID-19, was described at the end of 2019. And so as physicians, we really like to make evidence-based decisions and data-based decisions. And right now, we're working with the best research that we have available. As Ashley said, this data that we have is today. Things change. And we are all, and all the pediatricians and healthcare workers under the children's umbrella are always working with the data that we have and having individual conversations that are the patients in front of us. And that's what's most important. And that's what's so special about being a pediatrician.
Thank you all. Why don't we get to this one right away? It's a very popular question. Masks. Does Children's Wisconsin have a position on masks?
Smriti, you're on mute now. You're on mute now.
So we can just admit that I belong to the old group on this Facebook Live. Technology is not always my friend, but so we do have a position at Children's. At every one of our locations, we want our providers, staff, visitors, everybody to wear a mask. So we've all said we're learning about this virus as we go. The one thing that we do know is that wearing a mask decreases the spread of the disease. Different masks work differently. Some work better than others, but they all decrease the spread of the disease. Other things like hand washing and social distancing also help decrease the spread of the disease. So we definitely support masks.
Yes, and I'll follow up on that. This is a evidence-based answer that the evidence shows that masks work. The American Academy of Pediatrics is very clear on this. In middle schools and high schools, universal masking should be a very high priority, especially when physical distancing will be harder, like transitions between classes, riding the bus. Elementary school masking is also important. However, it can be a little bit more challenging the younger the patient. Although I was just making rounds and I saw a 1-year-old wearing a mask in a stroller. It happens, and it is doable. In a pre-K classroom, it's harder to enforce. It's hard to keep them sitting down for lunch. When adults have to work with those kids, and those kids can't effectively wear masks, the American Academy of Pediatrics does suggest the school districts provide surgical masks or N95 masks with face shields, N95s or surgical masks and face shields to help protect those adults.
And I have to say, in my daily practice, we are asking parents and children to bring their masks, and the response has been overwhelmingly positive. Yeah. I had a 2-year-old yesterday for his physical, 2 years old, that's it, no months on top of that, who wore a little animal mask for the entire time of the visit. He didn't touch it, he didn't play with it, and I think it's so important to message to our parents about the modeling and how we can make this our norm right now. And it's such a simple thing to do, but it's something that's so important and so trainable, and we just have to keep showing these kids, and I actually think the kids do better than the adults do sometimes with this.
My daughter was on Etsy last night picking out her mask for school.
They're trendy now too. They got good fashion colors.
Yeah, cool.
Yeah, if you can get their favorite character on a mask, that helps a lot.
For adults,
we all
too.
know that wearing, yeah. We all know that actually, speaking of that, we all know that wearing a mask can be an emotional topic, but for those it's on either side that it can be an emotional topic. Dr. Margolis, whether it's cheering for the Bucks or the Brewers or advocating for kids, people recognize you as a passionate person. How have you reacted to the question of wearing masks?
I was looking for my Bucks mask. It's somewhere. Oh, here it is. So there's my fashion statement right there. And yes, I am passionate about lots of things, and I'm very passionate about keeping kids safe. I do primarily take care of children who are immune compromised, and so vaccinations and masks are something that are near and dear to my heart. I occasionally get frustrated when I see somebody not wearing a mask, and I try to turn that passion into just making people understand. And so I think it's crucial to make time and have people understand, because nobody wants to hurt anybody else. Everybody's intent is positive. And sometimes we just have to remind people that masking, while new to our culture, is safe, it's effective, and it is data-based. And most people will get that. And so, we try to have fun with them. I've got Brewers masks now. I've got Bucks masks now. And I couldn't get the Hamilton ones because they were sold out too fast. And so there you go.
Yeah, Dr. Margolis keeps saying he's the old guy on this thing, which somehow defaults me to the young guy at 40, but he's the one with all the masks. I have a couple of them that I really like. I will say comfort matters a ton. You might have to buy a few, and I liked Dr. Bartz's idea of having his daughter get the buy-in of picking out her own mask. That helps a lot. Because this is, it has unfortunately become a little political, and there's a lot of uncertainty in people's lives right now and a lot of stress, right? And that has crystallized around mask wearing for some reason. But as Dr. Margolis said, it really does reduce spread. It is difficult for preschoolers to wear, and the American Academy of Pediatrics recommendation, even through 2nd through 5th, is a little hard to understand and comes down a little bit to what prevalence is in your area, how big your classrooms are, what spacing is. However, despite all that, if your kid can wear a mask, even if your school's not requiring one, send your kid in a mask. Teach them how to do it. My kids got their new masks, and I told them they could wear it during screen time, which obviously then they wanted to wear it for 9 hours the other day, which I didn't let them do. But I will say my oldest wore his while he was playing his video game with his hands busy, and at the end he was like, "Dad, I hardly noticed it was on," largely because he was playing a video game. But there are ways to get your kid acclimated to the use of the mask. And so even if it's not required, wear them. Teach your kids that it's a great way to show respect to those around them.
Yeah, I think wearing masks are just incredibly, incredibly important. I think it's really going to be important when we talk about schools, in the sense that, one, we're going to need masks within the community to decrease that community spread, so it's safer to get back to school. And also, when we're wearing masks within school, it's going to make those inevitable contacts with COVID less likely to spread. There's no doubt, given our current prevalence within the community, that there are going to be COVID cases within the school. And when we're wearing masks, we can decrease that overall spread so that we don't have continued transmission within the school itself. And the mask can definitely help. I think as we see that, we're going to see that things are changing, and we're going to have to be nimble. But the thing we can do is wear a mask.
Yeah, and while we have a lot to get to during this conversation, later in the conversation, we're really hoping to walk through a specific situation like you were just mentioning. Another hot topic is testing. It can be confusing, and people have a lot of questions like, where is testing done? How is it done? Is enough testing available? Dr. Veldhuis, can you get us started on this topic?
Yeah, so it is a hot topic, and it is confusing because it changes. I would say weekly, but it's almost daily now. The testing that we have available kind of depends on what's on hand. We were doing nasal swabs for a little while at our clinics, and now we have to do NP swabs, which is the deep one. So I got to tell my early patients that it was nice just to get a nose pick, and now they're getting a little bit of a brain pick with the deep one, which I apologize for, but that's the current test that we have, and it changes. So a great place to look is the Wisconsin Department of Health. They have the testing around you. If you're unsure, you can always call your primary care office, because even who we're testing changes a little bit. So right now we're testing hospitalized patients or patients that need surgery. Those are the kids at the hospital. And then in our primary care sites, we're testing kids who've been directly exposed. So that's a primary contact, which I think we're talking more about later, but basically is within 6 feet for more than 15 minutes. If that's happened to you, then you can get a test. Or if you're symptomatic enough to come in, and that's always the hard one. So if you don't know, call your office and we'll kind of walk you through, like, that sounds like a little bit of a cold, although it is going to lead to 10 days of isolation now, unfortunately. Or that sounds like enough that your pediatrician should actually check on you, make sure that you're fine, and offer you a test. So if you don't know, call. That's kind of what it comes down to at this point in time. I will say right now at children's clinics, if you just want a test and you haven't been exposed and you're not symptomatic, we're not offering that at the moment. There are some community test centers that will basically test everybody. But again, those even change based on where testing is. So it's going to result in a phone call, sorry.
Yeah, and I'd like to jump in. So while we're talking about COVID-19 testing, it is really important that we start in understanding some of this terminology that you're going to hear. So you just heard about exposure, which is when you're within 6 feet of someone with a confirmed case of COVID-19 for more than 15 minutes and you're not wearing a mask. And then after you're tested, we're still waiting for the results. If you've been exposed to someone, you need to be quarantined. And what quarantine does is we keep someone who might have been exposed to COVID-19 away from others. And the length of quarantine is really going to depend upon who the positive contact was. If it's a family member, it might be up to 24 days. If it was someone you were just in contact with, it might be 14 days. And the reason behind this is how we stop the spread, because we know people spread it before they have symptoms. So if you quarantine the people who might potentially become positive for COVID-19, you decrease that spread. So what does it mean to isolate? Isolate means you have COVID-19, you are sick. And what you can do to help decrease the risk, even within your own family, is to separate yourself. So I can tell you, when people get sick, if you have it available in your house, we recommend you have your own bedroom and especially your own bathroom that sick person uses. Just doing that can dramatically decrease the spread, even within your own family. And finally, separation. When kids go back to school, we know they're going to get sick. That's what happens. And so this is actually giving the schools a physical place where the school nurses or the nurse aides can actually put someone who they are concerned might have COVID-19 away from the other kids, because you all know kids go to the nurse's offices a lot. So we really need to separate who might be potential COVID-19 kids from just kids with other complaints. And so that is kind of the terminology difference that we're using right now. We'll be talking about screening just a little bit later, which is the questions we're going to be talking about before you go to school.
Yeah, thank you. That will be helpful for this conversation. And we'll talk a little bit more about each of those later on. Let's dive into the decision around going back to school. Should there be more consistency in what schools are deciding?
This is the question of the year. And I wish that we could say we had an easy answer. The reason we're here right now and the reason why there's such a heated debate in our country is because there is no easy answer. We know if you put kids together, you increase the chance of getting sick, you increase the chance of spreading things to the adults. However, we also know kids do so much better in person. And in-person learning is definitely the best for multiple reasons. And so there's an analogy that came out that kind of we're talking about right now, which is something called a light switch. Everyone's trying to say it's either on or off. You know, we're either all in or we're all out, and that's all we can do. And really, when you have a new virus like this that we don't understand, but we're learning more and more about every day, it's actually more like a dimmer switch. So we're learning more, we change things a little bit. We find out something that's not true. I think a great example of this is, how we talked about masks initially when this was first came out. People thought it wasn't necessary to wear masks. We thought only healthcare professionals and first responders needed them. However, the more we learned about the spread of this disease, the more important we realized that we had to kind of dim the switch a bit. And so I think that's really important. As I mentioned, this is so incredibly complex, but I want to go back to what the 6 guiding principles that the AEP shared. In order for schools to go back, they have to be flexible, they have to be nimble. We are teaching our kids in 21st century learning about changing with the times and learning to, really think outside the box. And we have to do that as school districts. The second strategy is, we know things are going to change. Things are changing rapidly. So any strategy that the school adopts needs to change based on the level of viral transmission in that school and that community at that time. And to really expect schools to be able to do that, they have to be able to look to someone, and they look to their local or public health authorities. The third principle is that policies have to be practical, feasible, and appropriate for the child and adolescent's developmental stage. There's a huge difference between a kindergartner and a high schooler, and we really need to make sure it's developmentally appropriate. Number 4, special considerations and accommodations to account for the diversity of use should be made. Number 5, no child or adolescent should be excluded from school unless required to in order to adhere to local public health mandates or because of their unique medical needs. And the last one is that school policies should be guided by supporting the overall health and well-being of all children, adolescents, their families, and their communities.
So that's, I think when I look at these guiding principles, it sort of really highlights the importance of thinking of this as a community issue. And I remember early on in the pandemic, our CEO, Peggy Troy, had said, the health of the communities really ultimately defines the health of the kids. And, it works the other way too. Our kids, if they stay healthy, the rest of the community stays healthy as well. And I think one of the things that we've really seen over these last few months is it sort of highlighted the health, economic, and educational inequities that exist in our state. And, those are things that we're going to have to continue to work on. But it also means that communities are different in the resources that they have and the ability that they have to support the people in the community. And so it makes sense that each community is making this decision based on the knowledge that they have of their own circumstance. And that's absolutely appropriate. It's also appropriate to remember that whatever decision one community makes, it impacts all their neighbors. And this is sort of a public health issue, so everybody's going to be impacted with what happens around them. And I think the other point I'd just like to make is any guidelines and recommendations that we have right now are really about mitigating the risk, of just decreasing the risk. What we know is that kids will get sick. We want to make sure that we are providing as much information as we can to decrease that risk and to make sure that we all continue to have healthy communities.
With that larger community lens in mind, what about teachers or school faculty? How do they factor into the decision to go back to school?
Let me take a swing at that. I think that as interim pediatrician in chief, since the beginning of this, our responsibility has not only been to take care of the kids, but to take care of our providers, our nurses, our doctors. And how do we do that? And I'm very proud of how we did that. Number one, those people that were really old, we told them to stay home, the people with comorbidities. Number 2, 3, 4, and 5 are masks, 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 and masks. And number 6 is the constant hand washing. And so I think that healthcare providers were considered the heroes in March and April. I'm going to challenge us to think of the teachers as being the heroes and the school janitors being the heroes as we go into the fall. And let's wrap around our communities with our teachers, the janitors, the people that are in the food service at the schools. Let's get them their masks. Let's get them hand sanitizer. Let's make it as easy for a teacher to get a mask as it is for a physician to get a mask. That way, we understand that we can take care of the kids, but we can also keep our community safe. And so we want to reduce that risk to the teachers. So I would challenge all the school boards to think about the teachers the way we, and I'm so proud of how Children's Wisconsin has done this, taking care of every human that works within our enterprise.
Yeah, I would agree with that. And if I could just jump into, it's really, really important to consider the teachers as you're sending your kids back to school. So Kristen was saying she was in a school board meeting till 3 in the morning sometime. I was on the phone with a couple of our teachers at our school this morning for a couple 1-hour sessions, just going over what does the library look like and what does singing look like, and some other considerations of teachers who might have special health needs. And so remember that when you're sending your kid to school. You know, one of the silver linings of this is kids are not getting as sick with this as we initially worried when it first broke, which is wonderful. I'm not saying that they're not at risk. It's not zero. It never is. But we do really, really know with age comes much more risk with this virus. And we have teachers that are going to be in the classroom with your kids.
Yeah, thank you. Bringing it back to the kids and kind of back to basics before we dive into even more in-depth conversation, let's talk about the symptoms of COVID-19. Dr. Margolis just mentioned that, you know, we have seen kids in the hospital and our adults have been able to take care of them. And we've heard about a lot what to look for in adults. What are the symptoms, like the loss of taste and smell? But what about kids? Dr. Bartz, what symptoms should parents and school staff be looking for?
Yeah, that's a great question, because I think as already alluded to, in general, kids have a lot milder disease than adults. I mean, I think we've all seen on the news with adults who are intubated and have the breathing tube and are in the hospital for months and months at a time. But for kids, it's much more mild. It can just be a fever, a runny nose, cough, fatigue, muscle aches, vomiting, diarrhea. And these can be symptoms of the common cold. And it can be very difficult to distinguish this from COVID. So I think there's a couple important things from this. And we've, again, utilized this strategy at Children's in the sense that, you know, in general, if you're sick, you go to school. If you're my kid, if you're sick, you have a fever, you get some Tylenol, you go to school, you tough it out. But I don't think this is the same here. We need to be keeping kids at home, just like we're keeping the staff and providers home when we're at the hospital, because it's really hard to tell the difference. I also think, I'm sure that many of the primary care providers here would support that. We need to get the regular vaccinations. We need to get the flu shots so that we can make sure that kids are well, and so we can help differentiate and at least decrease that overall prevalence of the kind of general viral infections that we're seeing. Because again, I really do strongly feel that the most important resource in the fall is going to be our teachers. And yes, the kids may have mild symptoms, but we don't want to pass it on to our teachers, who are the precious resource that can teach, whether it's face-to-face or virtual learning. So schedule those well child checks and make sure that your kids are up to date on their vaccinations.
Throughout Children's Wisconsin locations, but especially here at the Milwaukee Hospital, we treat kids with the most complex medical conditions. We've heard from many of those families who are struggling with the decision to go back to school. What is our message to those families?
So as a bone marrow transplant doctor, that's the conversation that we have annually.
No. Did Dr. Margolis freeze on us?
And this year is even more poignant because it's we all froze for a second.
I think you're back.
Something hit the pause button. Can you hear me again?
Yep.
Perfect. So we're used to this in bone marrow transplant and cancer. And so the secret sauce for our kids with complex conditions are our parents, who are great advocates, and the grandparents, who are great advocates. And so I think what we recommend in our clinic is, and what happens all the time, is these are personal decisions. These are personal decisions, and they not only impact the kid who's got the disease, but it's their siblings. I was in clinic today with a family, and there's a 6-year-old who's going to need a bone marrow transplant, but there's a 16-year-old and a 12-year-old. And what do we do for those kids? And these are immensely personal decisions. The no-brainers are wash your hands, wear a mask, physical distance. But then based on the individual situation, and take the time and talk to your healthcare provider. We want to have these conversations. There is not one size fits all. I love the dimmer switch. I'm gonna have to use that more often. But and sometimes you're gonna turn the light on really bright, and sometimes you're gonna turn it low, and we will have to change. And I think understanding the implications for this disease for the child, for the family, and understanding the pros and cons of going to school. And school provides so much. It's just not education. It's socialization. It's in many of our situations, it's food. And so it's food security. So have those crucial conversations. As interim pediatrician in chief, I'm here to tell you, our team wants to talk to you and have those conversations. And at the end of the day, you as a parent, as a grandparent, will make the right decision for your child.
Dr. Bartz, what about the kids that you see at the Herma Heart Institute?
Yeah, let's start by saying that we're very, very consistent with what Dr. Margolis first said. We, within the Heart Institute, have tried to be as consistent as we can. We try to look at the research as it comes up. And what we've consistently seen is that kids with congenital heart disease are not being frequently admitted. We're not seeing more disease in patients with congenital heart disease. In general, this has been the case really throughout the world. I was fortunate enough to see a presentation by one of the directors of the CDC, who is also a pediatric cardiologist, and they're, with the abundance of precaution, are still saying that patients with congenital heart disease are at high risk. But honestly, that's just because we just don't know. But the point being, we haven't seen lots of research saying that patients with heart disease are at increased risk. So we consistently are saying at this point, we don't believe that patients with congenital heart disease, their children, are at increased risk. We continue to stress the same. Wear a mask, socially distance, and wash your hands. We're reviewing the papers and research daily, weekly, as quickly as we can gather it to make sure that we are giving the right decision. But again, as Dr. Margolis alluded to, having those individual conversations are important. We'd love to be able to send out a blanket statement, but it may be different for a patient who's on the heart transplant list versus a patient who has an ASD that was closed 3 years ago. So I think it's different in talking to those families, but in general, we are supportive of going back to school because we think it's incredibly important. And in general, we're not seeing an increased risk in patients with congenital heart disease.
Great. What about other specialties?
Yeah, I said, I'm a cardiologist, so I don't want to speak for everyone, but at the same time, at the Children's Hospital of Wisconsin, we want to try to be as consistent as we can. It doesn't make sense if I tell you one thing, you go to my partner, they tell you something different, and then you go to a pulmonologist that says even something different. So leading up to this, I tried to poll as many of my colleagues as we can, and honestly, we were all very, very similar in what we were saying, starting with the idea that we'll be honest and say we're not sure, but at 3 months, 4 months into this, we haven't seen an increased risk in our complex patients. Therefore, it becomes a personal decision in regards to if you want your patient, your families, your children to go back to school. But in general, we haven't seen a whole lot of increased risk in patients with complex disease. Yes, we do have a few patients throughout the hospital that are admitted for COVID, but most of the time it's when they're coming in for other things. So as was alluded to, we are testing all patients prior to elective procedures. So maybe someone's coming in for ear tube placements, they end up maybe positive, or actually would defer that in that case, but a trauma that comes in, they may be positive. We're not seeing the hospital have a lot of patients with chronic disease with COVID.
Okay.
So just to follow up, that the immune system is really the underlying cornerstone here in so many of the specialties. If your child has a reasonable immune system, as somebody that rebuilds immune systems, my hunch is your kid is going to do okay. We have the go back to school conversation with everybody who has a bone marrow transplant because their immune systems are under construction for 6 months, 9 months, 18 months. And so the rest of the world is what my patients deal with every cold and flu season. And that's because nobody has immunity to this virus. So if it goes to, if you have a child with asthma, and they are it depends on how immune suppressed they are. But in general, those kids could do okay. Same with the organ transplant. It's the level of immune suppression and how each child's body is going to react. And for the most part, the outcomes have been very good, but none of us want to test it with the kids that have really poor immune systems. And that is, at least for the cancer and bone marrow transplant kids, we're doing our level best to keep this virus away from them.
Yeah, that makes sense. So we haven't seen our patients with complex medical needs be more prone to getting COVID-19, but in our general patient population, we have seen some rare cases of MIS-C, an illness linked to the coronavirus. Can you talk about what that is, Dr. Kari?
Sure. As Dave and Pete so well said, the risk for COVID-19 for kids, and we've seen about 5% or so of the kids that we've tested in our outpatient setting be positive. For most part, it's been a minor illness, but this is one of the things that we've seen across the globe. It's sort of a complication, if you will, of COVID-19, where you see persistent high fevers, really sick kids, swelling of the hands and feet, rash, red eyes, tongue, and multiple organs within the body that have inflammation. This started off being called the pediatric inflammatory multisystem syndrome, but is now officially named multisystem inflammatory syndrome in children. Children's was the first organization in the state of Wisconsin to report a case. We have had a handful of cases, and luckily for those kids, they've all been able to get better and go home. But it is something that we're watching for closely and helping report and study with the rest of the world. The important thing for parents is this is not a subtle illness. So these kids get very sick. It's not something you're going to miss. And so if you're starting to see symptoms of fever and rashes and such, absolutely give your physicians a call to further talk about it. But these kids are pretty sick, and you'll know if this is happening.
Thank you. And we actually have a blog on MIS-C available at childrenswi.org/newshub in case families want more information. Now, going back to school, what does screening look like? More specifically, where should screening happen as kids go back to school?
Sure, I'll jump in on this one. So this is one of the most important things that parents can do to help get their kids back to school. You need to screen your kids before they go to school. And what we're looking for is specifically fever, and we're talking low-grade fever. Things that normally we wouldn't have blinked at. 100.4 is something that we're now paying attention to. Things like a runny nose, a cough. Even more importantly, kids are presenting more with some GI symptoms. So they might have a tummy ache. They might be throwing up. And so you need to, and schools should have a screening list that parents can do, a checklist before they come. That's number one. If you don't have access to a thermometer, talk to your schools. A lot of them would be very willing to screen your child as soon as they got to school, or they might even help you get thermometers if they're needed. We need to be careful. We don't want kids to go on the bus if they're having any symptoms. Just think about all the places you can possibly spread. So on the bus, if they're standing in line, I think in general, we don't recommend screening at school because think what happens. You know, anytime you have to get screened somewhere, there's a line and then people are congregating, and that's absolutely what we don't want. And kids aren't the best at social distancing in lines with their friends. So that's really important. And I think just touching back to, this is a new virus and it's presenting differently in kids. So as parents, we've all sent our kids to school with little runny noses. You can't do that anymore if you want to have success in the school system. If your kid has a runny nose, call your doctor, see if it's appropriate to get them tested, and do not send them to school. That is the best thing we can do, along with the quarantining and everything else, if we want this to work.
Now, if a child is experiencing some of those symptoms and the parent has screened them at home before going to school, what's the next step for that parent?
Yeah, so this is kind of what we were talking a little bit about before, where as a parent, you have a little bit of an idea of how sick your kid is, right? If it's a runny nose and a little bit of a dry cough, but they slept fine last night and they're drinking water and running around the house and eating, they should still stay home. And it's a little bit more than, like Dr. Bensick was saying before, where you would actually probably send your kid to school. But now you're keeping them home, and you're keeping them home for a full 10 to 14 days. So if you're unsure, call your pediatrician. And especially if any of the things that I just said aren't there, you should definitely call your pediatrician. If they're not drinking enough, if they look like they're kind of laying around a little bit more tired than they typically would be, if they're having any trouble breathing, terrible night of sleep, all of those can be signs that there's a little bit something more going on. So give us a call. But what's going to happen then is it's this quarantine versus isolation. Okay, so quarantine is so the way I've kind of been describing it to my patients is quarantine is like how I ground my kids, which means they're home, but they still kind of run around the house and probably get away with a little bit too much. They're not in a specific part of the house. They kind of have they eat with the family, the whole 9 yards. That's quarantine. So if you've been exposed to somebody, so let's say you have a classmate that's positive, but your kid's perfectly fine, but the school's keeping them home. They're essentially in quarantine with you. Now, isolation is how my parents used to ground me, which is you get a portion of the house and you don't leave it. So like I was not allowed to step outside the door to my room. And if I even needed anything, I would lean out and say, Mom, can I have a bowl of porridge? Because my parents only fed me porridge. But no, seriously, in isolation, you're supposed to be even kind of away from the other people in your home. You're supposed to pick a zone, be away. You're trying even not to get your family members sick, who unfortunately your family members are actually in quarantine if you are an actual positive case. So sick kids should be home in technically isolation. We understand it's very hard to isolate like a 5 or 6 year old. They're probably going to have a little bit more run of the house than we would typically like them to be in isolation, but do your best to try to keep them away from their siblings. And that's kind of the difference between those two things.
So, and just listening to what you guys said, can we re-show the exposure slide? Because I think it's going back to that definition of exposure, and then those two, that's so crucial to have people in schools understand what an exposure is and what an exposure isn't. And I think that will really help with the next isolation and quarantine. I love, your parents should be running the country because we could,
They raised me, so they're not perfect.
I did want to add a comment with the exposure. The CDC clarified the masks, and they are saying that the N95s, the masks, the fitted mask that we wear in healthcare circumstance, is probably something that protects you from exposure. The cloth masks decrease the spread, but don't completely protect you from exposure. So the mask element does have to be evaluated when you have an exposure.
That's a good point.
Thank you.
Yeah, so if a child who was at home having symptoms had been in school prior to that, what happens then? Can you walk through that, Dr. Bartz?
Yeah, happy to. I'll try to keep it with porridge and pizza, I guess, is how we'll try to separate these people out now. Is that right? So I'll just go with the general recommendations that our team at Children's, and honestly, this is based on the guidance by the CDC, the AAP, and the Wisconsin Department of Public Health. But honestly, this is going to be different for every school, and every school is going to have a little bit different process of how they do this. One of the ways is, how did they originally set up going to school? Obviously, if everyone's in virtual school, it doesn't matter, right? The other thing that schools are trying to do is cohort into as small as possible cohorts as they can. Talking to our school board last night until midnight, that our school is going to try to do an A and B. So really trying to cut that down to half the amount of half the amount of kids, and therefore we're going to decrease that exposure. The other thing, as Dr. Kari alluded to, masks help. They don't keep you entirely safe, but at the same time, it's going to help decrease that spread, so one exposure doesn't lead to another one's symptoms to another person with symptoms. So that masking strategy is also going to be helpful, but it doesn't not necessarily depend on whether or not we call that exposure or not exposure. In that child who's experienced symptoms but has not been tested, they're going to be quarantined at home. So they'll be getting pizza at home and be able to be around their other family members. If that child tests positive, then they should be isolated. And then in regards to other students who spent at least 15 minutes, so that would be an exposure, is at least 15 minutes within six feet. Then the health department in the school is going to be reaching out to those individual students and decide what should happen to them in regards to should they be staying home and should they be quarantined.
And if I could just jump in, this is when you hear about cohort models. That's kind of what a lot of preschools and daycares in younger classes are going to be going towards. The cohort is that idea of, if one kid gets sick, everybody's a close exposure and they all go home together. But you try to keep the cohorts isolated as opposed to the specific children isolated from each other. So in little kids that can't mask or mask poorly, that's what the cohort word that you maybe have heard is.
And that's just to keep a smaller number of people exposed, quite frankly, right? So instead of having the whole elementary school exposed, it's just that smaller cohort.
Yep.
Yeah, and I jump into and just explain a little bit more of the AABB days that a lot of the high schools are talking about. And that's really where they're bringing in half the amount of kids. And so they're kind of cohorting the high school kids. So if you have a school with 1,000 kids, we're going to bring in 500 on 2 days. Most of them would take a rest day for deep cleaning. And then they bring in the other 500 kids. And the whole idea is we know high schoolers move around a lot more, but that way we can really try and really keep those kids together. So if there is an outbreak, we can really isolate and quarantine those kids that were exposed. So just a little further explanation, because a lot of these terms are being thrown around by a lot of schools and they're quite confusing.
And with the smaller cohorts, it allows more likely to keep your 6 feet distance.
Right, the social distancing gets promoted with that too.
Yeah, and in all of this, it sounds like it's going to be important for the schools to have a relationship with their local health department or health authorities. Correct me if I'm wrong.
Definitely.
Okay. What about the mental health aspect of all of this? Some kids may have been struggling with being disconnected from peers and could continue to struggle if they don't end up actually physically back in school. What signs should parents look for around mental and behavioral health during this stressful time?
Gosh, I'll take that one. I mean, isn't this just trying? You look back at the last 3-4 months of everybody's life, and everybody's world's changed, right? So normalcy is defined by what you did today, rather than what you used to be able to do. And so it's a huge area of concern. One of our child life specialists wrote a really nice blog that's on our website that talks about the things to sort of look for when you're worrying about the kids, behavioral regressions, especially for the younger kids if they're acting much younger than normal, exaggerated emotional responses, unexpected crying, sleep disturbances, things like that. There's a lot of research coming out globally regarding the increase in kids with problems with anxiety and depression, especially in the teens. So those are things to watch out for. So I think the best advice we could give is for the parents to be really vigilant and create circumstance so that the kids can talk to, kind of open circumstance of talking about things. Parents use different things to be able to get that conversation going. Maybe it's what's the best thing that happened to you today? What made you happy? What made you sad? Sort of opening the circumstance for those conversations. That's going to be really important. I think it's very, very important for the parents to think about themselves and really make sure that they're taking care of themselves. Always love the thing when you're flying where they always tell you to put your own oxygen mask on first before you help others, and you can't be helpful to your kids if you're not taking care of yourself. So really being very thoughtful about that. And I think the schools are spending a lot of time thinking about that, of how they're going to help support the kids, and looking at all kinds of opportunities around technology and how they engage their school psychologists and therapists to be able to help support the kids. I think an important group to think about is the teachers in this circumstance as well, and making sure that you have really good employee resources. It is one of the things that Children's has really been able to do for us, the employees and the staff, where we have employee resources where we can reach out and get the help that we need if we need it. And so those are all areas that we all have to be very thoughtful about.
I would agree completely. This is a drum that I've been beating since sort of the start of this. Is there is a risk to your children with this virus, but you can't just stick them in their room to keep them safe from the virus and expect them to do well. Mental health is incredibly important, especially with our teenagers. So the silver linings in some of these things are some of the things pediatricians have been telling people to do for forever now. They kind of have to. So you got to hang out with your family a little bit more. Family meals are awesome. Go outside. We know outside is decreased transmission. So there are other ways to do things to find the silver linings. I mean, with all of my kids' stuff canceled, I found out I actually kind of like them. We found out a lot more, and life has been good in a very weird way. I didn't realize I could still play a game of lightning against my kids in the driveway. Now, the flip side of that, though, is as people are deciding to go back to school, some people do have some options. Some schools are offering virtual versus being in person. And some people have very strong opinions about that. Try not to judge other people's decisions on that, because kids are super different. Some kids went to distance learning and did great. Like, in fact, some kids maybe did even a little bit better. They got their homework done in 4 hours and then moved on and did some extracurricular stuff on their own. That's not most kids, though. Some other kids struggled. They didn't do very well at all. And some other kids, it was so hard, they just checked out and went to their rooms and really kind of fell apart. And as a parent, you know a little bit how your kid did with distance learning, and that might have to give you a little bit of an idea of what you should be doing with your child come the fall if your school is offering stuff. Also, we have kids that are on like IEPs or PTOT, speech therapy. There's lots of different services that schools offer. And when schools go virtual, each school is going to be able to offer different things in different ways. And so you're going to have to touch base pretty quickly with the special education or the resource department within your school to find out what's available. And if it's going to be nothing or something that's not quite going to meet the needs of your child, you should really call your pediatrician, because Children's does have a whole host of things that we can offer people in those departments. And be aware that Children's, like, we have not forgotten you. There's advocacy that's in play. We're trying to work on internet access for those that don't have it, and other advocacy issues, just supporting people who, hot lunch programs, food and hunger. There's other things that we really focus on at the hospital that schools supply. So call your doctor. We might be able to help you.
And I can just add on a little bit about the mental health. I think one of the things, social distancing does not mean social isolation. And it's really important that you help your kids connect with their friends. And these can be done in multiple modalities, whether it's FaceTime, whether it's having them outside. Some parents are opting to have what we call the bubble, where you have, a group, like 1 or 2 friends where you trust their family and you guys are just kind of hanging out together. But you really cannot underestimate the power of friendship and socialization, especially with anxiety and depression. My 10-year-old told me 2020 was the worst year of her life after 3 months. And I said, now we're setting up a play date. And I think it's really important. And you can't, some kids show things differently, and that maintaining those connections, I agree. I've never spent so much time with my kids, but they need their peer groups, they need their friends. And so really just emphasizing that any way you can get it in a safe manner.
And I loved how Paul said, it sort of brings you back to your family. We are all sort of a bit on the hamster wheels of making sure our kids get all the opportunities they can for activities. And this might refocus families to get together and have dinner more often together and find a newer pace of life.
We love our adult children coming home and having dinner
I know,
all the time. All the time. They're watching this, so I got to say that.
What tips do you have for how to help kids prepare for either going back or not going back to school?
Well, yeah, I think parents know. Actually, parents know the answer to this question. Parents naturally lead by example. I go back to when my kids were starting to learn to ride a bike because their dad is a nerdy pediatrician. Their nerdy dad wore a helmet because he wanted them to wear a helmet. And so in this time, it's crucial for parents to model that behavior. Model the behavior that you want. Wash your hands, wear a mask, physical distance. Kids see mom and dad doing that. Kids see grandma and grandpa doing that. Guess what? Kids are just going to naturally do that. So I think the kids will be ready to rock and roll when they're the people that they look to the most, which are their parents and their grandparents, are doing the behaviors that keep them safe, and that will translate to school.
The other thing that I think is so important is you cannot underestimate the importance of routine in kids. This is such a challenging time where there's so much uncertainty. Kids thrive on daily schedules. And so whether you're in the virtual learning environment or you're in hybrid, you need to have kids have set bedtimes. You need to have kids have set awake times. You need to try and maintain as much as possible a normal school schedule for these kids. They will thrive. And especially our adolescents who are like my oldest son who like to stay up all night playing video games. You got to get them off, get them to bed, and get them up in the morning. And I think, you will see they're really yearning for that back to normalcy. And as much as we can give them that, it's so important.
Yeah, I would completely agree with that. And the old adage, like practice makes perfect, when it comes to all these new things that we're teaching kids to do, really is true. Practicing wearing the mask, starting in small doses and working your way up, and making a game out of it. Positive sticker charts work great for little kids, and little rewards at the end of the day. And teaching them social distancing, have them have some fun with it. Give them a plastic lightsaber or something, and say, if you can touch the other person, you're too close. But I love what Dr. Margolis said too, like set the example. So when you're standing in line, don't stand so close to the person in front of you. I took my daughter to the farmer's market the other day, and we just kind of made sure, and she naturally crept up, like, just always creeping up in line, and just the, gentle reminder, like, hey, step back, come stand by dad. By the end of the hour we were there, she had it down. So lots of practice.
Yeah, one thing I've learned a lot over these last 4 months is that everyone's going to have different experiences and different opinions, and there are different reasons for all those different experiences and different opinions. Specifically with masks, we obviously recommend that everyone wear a mask, but there are going to be people based on their special needs or special situations who may not be able to wear a mask, and not to judge. Do what works for you. Do what works for the family. And talk to your kids that everyone's going to be a little bit different. Some of those kids some of their friends are going to be in virtual classes. Some are going to choose to do face-to-face, and some are going to end up doing hybrid if the school districts give families choices.
Yeah, and I probably would add that it's really, really important to listen to your kids and create circumstance where they feel comfortable talking to you. I loved your example that you used, Kristen, where your 10-year-old was really comfortable telling you that she was having a hard time, and you were able to fix that. Those are the sort of things that will make the difference. I think it's also important for families to remember that their schools and their public health departments are really making the best decisions they can with the information that they have, and working with them to be able to create safe circumstance for the kids is going to be very important.
Yeah, we have blogs at our website at childrenswi.org/newshub with tips on how to talk to kids about COVID-19, or tips on how to get them to wear masks and more things like that. And we continue to add resources there. So if you need any more information, go to our blog. Before we dive into questions submitted by people watching live, which I promise we will get to, I'm going to ask you guys a tough one. Bottom line, would you send your kids back to school?
I'll take the easy way out because my kids are older. But the way I think I would have approached it is my kids are healthy, and that school is important. I'm blessed with healthy children. And I hope that I would have been brave enough to join the community that we're in, and if school was open, to be able to do it. But that's because I have two, thank God, healthy children who are both in the workforce now. One of them working over at Freighter, and so she's exposed. But I think that going back to what I was saying, I've got healthy kids, so I would probably do exactly what some of you all are doing, is working with the school system to do it as safely as possible.
Yeah, and I would, I have 4 kids. I have one going off to college who is going to go, and I have 2 high schoolers and an elementary schooler, and I feel very confident in sending them to school and feeling that they're going to be safe. I feel like the school's working hard. It's going to probably, they're still deciding. And I think, with the hybrid environment, with teachers protected, I am seeing what we've seen in clinic, which, not kids aren't getting as sick as we first thought they were going to. And if we can get kids to wear masks and teachers to wear masks and work on social distancing, I think these are teachable things. And the things you lose by not being educated in person are almost innumerable. And I think, everyone has to do what's best for them. I agree. I am blessed with healthy children too. If I had a family member who was, immunocompromised, I think my decision would be very different. And so I think it's very hard for people to look at other people and say, you should do this, you should do that. You should do what's right for your family and what you're comfortable with.
Yeah, my kids are going back too. I'm the school board president, like I said. So if I didn't send my kids back to school, I did something seriously wrong. But no, I am also in a position where my kids are healthy and I don't have any elderly people living with me, nor are my kids in contact with people who are high risk on any sort of regular basis. So like I said before, we're kind of teaching them, mask up, keep your distance, be respectful, and they'll be back in school.
I'm on the same boat. I have 3 healthy children, and they will all thrive by seeing their friends. I mean, that is by far been the hardest thing that they've struggled with is not having that social interaction. So we will work on our masks. We will work on our social distancing. And if school happens, my kids will be going back to school. And if we have to do a hybrid or virtual, we'll get by. But again, it's a decision that for each family, which may be different, and for our family, that's what works best for us.
Yeah, and I think that's really what I'm hearing as I'm hearing all of you talking. It is a very personal decision. It also makes me reflect that there are lots of parents out there that might not have the choice, who might be in essential jobs, who are counting on the schools to make sure that their kids are safe, and just being cognizant that everybody is going to make the best decision that they can based on the circumstance that they have. And I do have an adult child, and so I don't actually have to make this decision for the fall. I do tell her to go to work every day, so that's important.
And so I'm not a hypocrite. I do want. So I'm not a hypocrite. I do want whoever's out in Facebook land to know that my patients that I counsel who are immune compromised, who don't have immune systems, I am telling them not to go to school. Mm-hmm. And I am telling their siblings, if they can handle, just like Dr. Kari said, if they can handle not going to school, because my patients' immune systems are horrible, and I do worry about what my patients will go through. So it goes back to that beginning of having really frank discussions and individualizing it. And thank goodness the school systems that are dealing with my patients are being very understanding. And most of them, and I got a family that's in Florida, and I was asked this question about a month ago, because Florida starts in mid-August, and then the coronavirus was spiking. And so originally it was, it might be okay. And then we had to change it, and their school system allowed them to opt into virtual learning. And that was what I recommended. So my recommendation as a physician goes back to how healthy are my patients. So I may tell my kids to go to school, did that forever when they were young. But I may tell my families to stay home.
Yeah, and I think I'm going to have actually Dr. Veldhuis jump in here. He had a really great analogy and conversation earlier this week about why what you might choose might not be perfect for someone else. Dr. Veldhuis, do you remember that analogy?
I do. Yeah. So what I tell my patients about vaccinations, for instance, is when I go to the mechanic in my car, there's something wrong with my car. I always ask the mechanic, like, would you fix this if this was your car? And if he says, yeah, and he's a trustworthy dude, then I do what he says, right? So when it comes to vaccines, if you go and you talk to your pediatrician's vaccinating his kids. It's the easy, like, if they're doing it, they're not trying to pull the wool over your eyes or do anything harmful to your kid. Do what your pediatrician does, vaccinate your kids. This is actually different. My kids are going back to school because I have a completely different set of circumstances than my patients do. So this is one of those times where asking us like what we're doing with our kids might not be as helpful as asking if I vaccinate my kids, right? Yeah. So I have had a lot of conversations and I have told some of my patients, he needs to go to school. Like he needs the interaction. This didn't go well for him. This was a problem. If in-person learning is happening, make it happen. And I have some of my patients where I'm like, they did great at distance learning. And there are some medical issues that we should be a little concerned about. Maybe pull back and try to stay at home this semester. So really, this is a really personal family decision. It's not one just to kind of follow the crowd on.
Great points.
Yeah. All right, we're finally going to do it. We're going to jump into questions provided by the audience. A quick reminder that we'll be trying to answer as many questions as possible now. We are a little over time, but I'm hoping the doctors here will stay with us for a few more minutes. But we will continue to answer questions in the comments after this conversation. So continue the conversation within the comments and we'll still be responding. Let's start with some questions that were asked in response to this event over the last couple of days. So, Dr. Kari, can you speak about the effectiveness of masks for kids at different ages? Do masks work for kids of all ages?
Sure, they do. So a mask will, the ultimate goal for the mask is to decrease the spread of the disease. And so, as I mentioned earlier, the N95s that we wear in the medical circumstance that are fitted obviously protect you the most. Surgical masks after that, cloth masks after that, but each one of them is going to be effective. I think a couple of things here for kids less than 2 years of age. We do have to be careful about the mask use because there is a risk for strangulation if they're not careful with how they use it. So you want to be very careful about that. We do know that in younger kids from 2 to 5 years of age, they're unlikely to use the mask as consistently as we would like them to. So it will not be as effective as it would be for an older tween or teen who can consistently use it. So important to make sure that the mask is actually covering your nose and your mouth, which, we've all been outside and seen masks resting underneath the nose. That does not make them effective. So if they're worn correctly, and we recognize that for the younger kids, it's hard for them to keep it on for a long time. And so it's important to build in breaks and such. They are effective.
Okay. Dr. Bensick, can you share your thoughts on differences between elementary, middle, and high school considerations?
Absolutely. I think elementary school is so critical in a child's development. In the virtual learning, they need to build that teacher relationship. Part of going to school as a kindergartner is learning how to follow directions. It's learning how to interact with your peers. It's learning that process. The other thing we have to look at is, reading development and mathematics development. And, we can't expect, we're expecting a lot of our parents to try and be able to teach this. A bigger concern even is, what about those kids who have minor reading disabilities or minor math disabilities and really need the teacher to kind of delve in and see where is that being missed. And so I think looking at this, we're able to cohort these elementary school kids in their classroom much easier. There is some data, and it's, as usual, we're learning everything, but there's some data that kids, under 10 might be transmitting less. And with masks, I think schools really need to take into that developmental concerns of the elementary school level. The middle school and high school level are very different. We have a lot more mobility, kids change classes, but I also think we have a lot more personal responsibility there. We really need to empower our kids to take responsibility and really do what we're teaching them to do. Besides the mask, they need to stay away from their friends. They need to wash their hands frequently. When they're out playing sports right now, it's killing me because we're seeing kids doing high fives. This is the stuff we need to really teach our kids and say, it doesn't matter if you're in the school or if you're outside of the school. You have to continue to do these things because the data shows that kids 10 to 20 are spreading it, and really our higher risk ones are probably our teenagers who think, they're invincible and, they know they're not going to get that sick and it's not that big of a deal. It is a big deal and we need to help stop it. So I think there's a lot of plays schools can do with this age range. I do think they do better virtually than the elementary school kids do, but I think everyone does better in person. So even if they get some teacher time, that's better than no teacher time in person.
Okay. Dr. Veldhuis, do you have any thoughts on bathrooms at schools and how those could be safely managed for children?
Yeah, that's a great question, actually, and that's going to be school by school. So there's going to be a lot of talk about staggered start times, or basically staggered everything, and then one-way flow of traffic. So that doesn't just mean the start and end of the day. It also means who goes to the bathroom when, and maintaining distance when you're headed to the bathroom, and a way into the bathroom and a way out of the bathroom if possible. Now, lots of bathrooms basically only have one way in and one way out, right? But wiping handles down on the way in, anything schools can do to do touchless surfaces can be really helpful too. Each school, that's kind of like what I was saying before, is each school has a very different environment, even weirdly when it comes to the bathroom. Some of them are small, some of them are big. And so really it's a surface issue. The good news is it doesn't live on surfaces like 5-6 days like we initially thought. It definitely can be decontaminated pretty quickly if you can wipe it down with a disinfectant. And so there is a role for teachers too, to be carrying around a little bit of a squirt bottle and a paper rag to be wiping stuff down behind children, which I know is not what they went to school for, but is something we're going to be asking of them this year.
Sure. Dr. Bensick, is there any way to tell if someone in a classroom is transmitting the virus?
So I think this is the point we're trying to get across to our kids. A lot of times you might not have symptoms, but you're still able to give it to other people. The obvious ones are the ones who are coughing or sneezing or have, our lovely little kindergartners who've got the snot just coming down their nose. We know they're transmitting things. Whether it's COVID or not, we don't know. But I think the more important message to get to kids is you can give it to people without being sick at all. And so you have to do those things, everyone. We keep harping on the masks, the social distancing, the frequent hand washing. It's so important.
Okay. Dr. Bartz, what are your thoughts on special needs kids with individualized education programs that really need in-person instruction?
I think the most important thing is really going to be the communication that the parents have with the schools, and then reaching out to children as an advocate if they need to. Parents with special needs kids are the best advocates for their kids, and they know how to get this done, and just to have those conversations early so that their kids can get the education they need.
Okay.
Having a wife as a special needs educator, I don't know if she's going to text me during this, but I would argue that those special needs educators are heroes as well. I can't imagine the patience that they have, and I think if we can get those kids into the school environment, into that structure, and have that extra reading and that extra math is going to be so vital. So working with the school systems, getting those schools to protect the teachers and getting those kids there will be so great.
It gets back to them being our most precious resource, right? We want to protect them.
Yep.
Sure. Dr. Bartz, similarly, we've received a lot of questions about kiddos who may be immunocompromised returning to school. We know we covered it earlier in the conversation, but we got so many questions about it. Can you repeat one more time for us kind of the main takeaway for those families?
Yeah, again, I think it's having that conversation with their individual provider for the kids who are immunocompromised. I think if you have complex medical disease in general, it's probably going to be safe for you to go to school, but this was immune compromised. I did kind of a straw poll of many of these solid organ transplant doctors here. They all felt that it would be reasonable to go to school, given that you were far out and not on the active transplant list. But obviously, as Dr. Margolis said, there is a spectrum, and he deals with the sickest of the sick. And if there's any concerns, speak with your provider. We are here and happy to talk to you about that. Dave, anything else?
No, I would defer to the primary care pediatricians here about the question about a newborn. I think it's a great question.
Yeah.
If what do you do with the siblings of the newborn baby? I think it's a wonderful question, and I don't have the answer to it.
Yes.
All right.
Go ahead,
You want to take it?
No, go ahead.
I think in general, we are so protective of our newborns as pediatricians. We always talk to our parents about how important a fever of 100.4 rectally is in kids under 8 weeks old and how you have to call us right away. And we know that because this age range is more vulnerable. And so I think I even tell my parents of newborns that when your parents come over, the new grandparents who can't wait to grab the kids, I'm like, they have to have masks on. They have to wash their hands. If they're sick, they can't come near the baby. And I think with our siblings, it really depends on the age of your sibling. If you have an older child who's very responsible, I would still have them wear a mask if they want to hold the baby if they're going to school. But I think you could let them do it. If you have a 2 or 3 year old who you're talking about, should I send to daycare or not daycare? If you have the option, and this is back to we don't know what parents' circumstances are. This is back to individual circumstances. If you have the option of not sending them, obviously we would prefer to decrease the amount of possible exposure, and I would recommend keeping the kids home with you. But I'm not in your life. And so the most important thing to remember is that how can I decrease exposure? And if we have other people coming to touch my baby, how can I make sure that we do the best we can to keep that baby safe? It's so vital.
I would 100% echo that. And I've been telling all my parents of newborns, I still worry about influenza and RSV as much as I did before coronavirus. And those are two pretty bad illnesses when you give them to newborns. So coronavirus might even be number 3 on the list of things that I don't want your newborn to catch. So really hand washing, keeping the snot-nosed kids away, trying not to pass the baby around at functions, really kind of keeping it limited to just really close family members who need to hold the baby for that sort of emotional bonding and reasons. I think that's an important thing with or without coronavirus.
And the perfect time to make a plug for vaccines, right? So make sure you get your flu vaccine this fall. Keep yourself protected from influenza, and especially around newborns, the adults should be getting their Tdap so that they can protect themselves from whooping cough and keep themselves healthy.
I can't re-stress that enough. We are going into RSV, influenza. The last thing we need is pertussis outbreak in this community. So let's vaccinate against the things we know we can vaccinate against, and that will help all the pediatricians in the community figure out what your child has. And I think going into the fall and the winter, I know that one of the things that has me concerned is influenza, RSV. I hadn't even thought of pertussis, but we know from history. I'm old enough to have seen it in our state. When we don't vaccinate well, we get pertussis outbreaks, and pertussis can kill children, as can RSV. And so it's really important to keep those, get the vaccines that you can, get the Synagis if it's indicated, and let's do our best to keep the babies protected.
Okay. Dr. Bartz, any thoughts on what would happen to kids who have medical conditions that just happen to have symptoms similar to COVID-19? How should families and schools manage that?
Yeah, I think that this is definitely going to happen, and again, the importance of making sure everyone is immunized, because as we get into the cold and flu season, there are going to be kids who have symptoms. Also, there are going to be kids with chronic diseases who have symptoms that are similar to COVID. You think of someone who has a lot of allergies and they have a runny nose, someone who has a chronic cough because they're on some medications or they have asthma that gives them a chronic cough. And I think, again, the parents know them best. They know, is this something normal or is this something different? I think at Children's, we learned from this in the sense that early on, we were trying to keep anyone who had any symptoms that were even possible to to being COVID away from the hospital, we learned that we need to make sure that patients are getting their care. So that kid who has the chronic cough is now coming to the hospital. That kid who has that chronic cough, hopefully we can get them into the school as well. But I think, again, it's going to take that conversation with the school. It's going to take that knowledge of the individual parents, and then also talking to your providers.
Okay. And Dr. Barnes, your team often follows congenital heart patients through adulthood. With that in mind, do you have any tips for teachers who may have congenital heart problems and how they should approach returning to school as teachers?
Wow, that's a great question, because obviously, as we're talking about, kids tend to get milder disease, but we know age is probably one of the biggest comorbidities. And I think it gets back to, again, taking all those factors. What's your immune system? What kind of congenital heart disease? Your age? And then honestly, what are you going to be doing when you get back to school as a teacher? Are you able to cohort and socially distance and wear a mask? Are you going to be doing virtual schooling? So again, I feel like a broken record here, but it's kind of an individual decision, and we're here to help walk through those individual decisions if needed.
Okay, just a couple more questions here. Dr. Bartz, another one for you. Any thoughts about COVID-19 and childhood asthma? I know you talked to the different specialty areas, and any thoughts you could share about asthma? Yeah,
I did individually speak with one of the pulmonologists, and the overall feeling again was, if their asthma is well controlled, that COVID is likely going to be a mild disease, and going back to school is a reasonable thing. So again, it gets back to, if your disease is well controlled, it makes sense to get back to school if that's right for you and your family. Okay. Dr. Kari, back to basics about COVID-19. We had this question a couple of times. Can kids carry and spread COVID-19?
Yes. So we've said a little bit about how kids tend to have a milder illness. And if you look at the data, the kids less than 9 years of age tend to have less of a chance of getting the disease. It increases as they get older. We also had a recent study that came out of South Korea that looked at some 60,000 kids and felt that the spread for kids less than 9 years of age was less than the 10 to 19-year-olds. And so both are true, but the risk seems to be higher for kids kids older than 10 years of age.
Okay.
I did want to do a bit of a follow-up on what Pete answered for the teachers who have congenital heart disease. And, we've talked a lot about the kids and how they can protect themselves. And all of us have teachers in our lives, and sort of just a great time to remind them that they should also be very vigilant about their own interactions and making sure that they have their masks on and they're protecting themselves. They're doing the social distancing and looking at their own risk factors and making sure that they're working through their employer if they are high risk, and protecting themselves as well.
Okay. Dave, what did you say? Our teachers are going to be our heroes for the fall, and we have to protect them.
Yeah.
Okay, Dr. Veldhuis, what is the recommended distance that should be kept between students? We've heard both 3 and 6 feet. Can you give us a little bit of clarification there?
That's a great question. So the CDC is going to recommend 6 feet, and the CDC largely puts its recommendations out for adults. And it's for the entire country, and 6 feet has been sort of the standard answer since the beginning. And it's a good one, and we should try to maintain 6 feet even in kids. However, the AAP does say that when 6 feet cannot be maintained, especially in the lower grades, 3 feet is okay. So it's kind of similar to everything else we've been talking about. Look, if your kid, has autism or ADD or a tic disorder or some reason that they just can't keep their mask on their face, right? Like their mask is going to come off. It's not an ideal situation. This is the same thing. If your school, it just isn't quite big enough and you've got to go with 4 feet of space in between the desks, try to keep that in the lower grades. Don't keep it in the older grades. So they're giving schools a little bit of wiggle room there, especially in the lower grades, because like Dr. Kari said, under 10, they definitely spread less. And it's the easy way to think about it is just littler bodies, littler lungs, littler cloud. So 3 feet is probably appropriate when somebody is only 3 feet tall.
Okay. Now we're getting to some questions that were submitted while we were having a conversation. So what is your perspective on kids playing on playground equipment at schools? Anybody want to take that one?
I'll take it. I think what we would like schools to do is kids need to get outside and play. And so once again, it's about mitigating the risk. And so if schools can divide up the playground and a cohort, the elementary school level can only have those kids play in that area, that helps. You have the kids wash their hands going in, you have the kids wash their hands coming out, and then somebody sprays that down in between. And you stagger the time, so there's a limited number of kids. And I think there is a way to do this safely, but once again, it's all about the pre-planning. It's about the teaching the kids the proper etiquette and, doing the best to mitigate the risk while realizing the benefit of play.
Okay, great. Now we are significantly over time. I appreciate you guys staying with us. Before we wrap up, real quick, is there anything else you guys want to mention?
Us guys?
Go ahead.
Yes.
Us guys. Hashtag teachers are heroes. That last question. I hope that our communities can rally around our teachers the way they rallied around the healthcare workers. You're talking to the guy that was featured in the Major League Baseball ad with Christian Yelich. I didn't do anything special except for I know Yelich. Let's get the teachers to get the equipment that they need, the safety that they need, because that is what's going to allow our kids who need to go to school to go to school. So I completely agree with the question. We just can't focus on the kids. We have to focus on the teachers and staff and the bus drivers. And they're going to have to be probably having the same issues that we as healthcare providers. You don't go in if you're sick. You self-monitor, but you have hand sanitizer everywhere. You've got masks everywhere. And let's think of our teachers as the heroes for the fall.
Dr. Kari, anything to add?
Oh, it's hard to add anything. That was so well said, Dave. But I was going to go with a very basic message. Remember the 3 W's: wear a mask, wash your hands, watch your distance. That's how we keep this in control.
Dr. Bensick?
I just want to add that talk to your doctors. We are here for you. We are a great resource for you. And I think we can help delve into some of these ideas of giving you some advice on what works for your family. And if you have concerns, give us a call. If your child is sick, give us a call. We are here for you, and we want to help take care of our kids. They are our most precious resource.
Dr. Veldhuis?
Yeah, I'm not surprised this went a little long, because I think if coronavirus has taught us anything, it's that everything, including school board meetings, go long. And on that note, we're actually taking a little extra time with our well visits right now, because we are expecting all these questions. So we've even built in a little extra time into our days to answer questions. So schedule your well visit, schedule that flu shot, like Dr. Kari said. Get in, get your vaccines, come and ask us your questions.
Okay, and Dr. Bartz?
Yeah, I would just reiterate that, we're here for you. The specialty clinics here in the hospital, we've done an unbelievable job at making it safe to come see us. And if there are specific questions, and continue with your routine care, whether it be well child or your general specialty clinic visits, reach out to us. We're here.
Awesome. Well, that's all the time we have for questions tonight. However, we will be continuing the conversation and be answering as many questions as possible in the comments, so continue that conversation. Thanks to all of you for taking time to answer questions today. We really appreciate it. I know the families really appreciate it as well. As parents work through these decisions, we know it's tough, and we know that we're here to support you. At Children's, we're taking steps to keep our patients and our staff healthy so our teams can continue to provide the best care. We will be here to help you care for your child, and that will never change. Please do not hesitate to call your child's doctor's office, use MyChart messaging, or our online urgent care. If you have any questions about Children's Wisconsin or COVID-19, please visit childrenswi.org/coronavirus. There you can find all kinds of resources, from details about children's locations to blog posts on topics like this one. Thanks again for watching.
Fear the deer, respect the virus.
Thank you.
Thanks, guys.
Bye, everyone.